Hepatitis in relation to liver failure, created by Margarita, Jennifer, Carrie, and Angela. The liver is referred to as the hepatic system and is one of the most important organs, performing more than 400 functions and affecting every system in the body. The liver is the largest solid organ, the largest gland, and one of the most vital organs that functions as a center for metabolism, for nutrients, and excretion of waste metabolites. The liver's functions are to filter blood coming from the digestive tract before being released to the rest of the body, detoxify chemicals and metabolize drugs, secrete bile and make proteins that are important for blood clotting and other functions. Loss of hepatic function must be dealt with immediately in order to prevent permanent damage or, in the worst case, death. What is hepatitis? Hepatitis is a disease of the liver and is defined as the widespread inflammation of liver cells. Hepatitis can be self-limiting or lead to fibrosis, cirrhosis, and liver cancer. There are many types of hepatitis. However, viral hepatitis is the most common and can be acute or chronic. Viral hepatitis consists of 5 categories named hepatitis A, B, C, D, and E. Hepatitis can also occur secondary due to an infection due to other viruses the patient is currently battling. Other types of hepatitis are referred to as non-AE hepatitis. How does someone get hepatitis? Hepatitis A and E are contracted through the oral-fecal route, from fecal contamination through person-to-person contact or by contaminated food or water. Hepatitis B and D is contracted through blood, semen, and other body fluids. Common sources are needles, cuts, transfusion, hemodialysis, and etc. However, hepatitis D cannot occur without hepatitis B being present. Hepatitis C transmission is blood to blood, with a very low rate of transmission in a single couple relationship. It cannot be transmitted by casual contact. Non-AE hepatitis is contracted from exposure to drugs or chemicals through inhalation, ingestion, or parenteral IV administration, causing liver injury. Hepatitis can also be caused as a secondary infection during the course of infections with other viruses, such as Epstein-Barr, herpes, varicella, and cytomegalovirus.
Diagnosis. Hepatitis A, B, and C are usually confirmed by acute elevations in levels of liver enzymes, which indicate liver cellular damage, and by specific serologic markers. A physical assessment is also done by identifying signs and symptoms of hepatitis, such as liver being tender or swollen on examination, or if the eyes are jaundiced causing any yellowing. Levels of ALT and AST may rise into the thousands in acute and severe cases of hepatitis. Serum total bilirubin levels are elevated and are consistent with the clinical appearance of jaundice. Diagnosis continued. A liver ultrasound can show the amount of liver damage present. A liver biopsy may be done to confirm the diagnosis of hepatitis and to establish the stage and grade of liver damage. The presence of hepatitis D can be confirmed by the identification of intrahepatic delta antigen or by rise in the hepatitis D virus antibodies titer. Hepatitis E antibodies are found in people infected with the virus. Hepatitis E testing is usually reserved for travelers in whom hepatitis is present, but the virus cannot be detected. Signs and symptoms. When assessing for hepatitis, you want to assess for abdominal pain, changes in the skin or sclera, diarrhea and constipation, changes in the color of urine or stool, fever, lethargy, malaise, nausea or vomiting, and pruritus.
So for the treatment of hepatitis, the plan of care for all patients is based off of resting the liver, promoting cellular regeneration, and preventing complications. So for rest, this reduces the liver's metabolic demand and increases blood supply. Rest periods with periods of activity are enough to promote hepatic healing. Activities are added as tolerated by the patient. For diet, food implemented post-nausea and anorexia, you want high carbohydrates and calories, moderate fat and protein, small frequent meals, and high-calorie snacks and supplemental vitamins are encouraged. As far as drugs go, they're used sparingly to allow the liver to rest. Sometimes antiemetics may be used for nausea. Hepatitis B and hepatitis C are commonly treated with antivirals and immunomodulating drugs. So, for example, hepatitis B, you might see tenofovir, adenofovir, lamivudine, or entecavir prescribed. For all of these medications, you want to monitor the kidney function due to the damaging effects that they could have. For hepatitis C, you commonly see prescriptions such as tenofovir, boceprevir, and ribavirin. So, prevention of hepatitis. In general, you want to maintain adequate sanitation and personal hygiene by washing your hands before and after using the toilet, before and after eating. Drink water that's treated by a purification system. If traveling in underdeveloped or non-industrialized countries, drink water only that's bottled. Avoid food that's washed and prepared with tap water, such as raw vegetables, fruits, and soups, and avoid ice. Use adequate sanitation practices to prevent the spread of disease among family members. Don't share bed linens, towels, utensils, or cups. Do not share needles for injection, body piercing, or tattooing. Do not share razors, nail clippers, toothbrush, or water picks. Use a condom during sexual intercourse or abstain from this activity. Cover cuts and sores with bandages. If ever infected with hepatitis, never donate blood, body organs, or any other body tissue. So, for prevention, vaccines and immunoglobulins are available for hepatitis A and B. Vaccines should be given before exposure as a preventative measure. Hepatitis A, you want to get the vaccine before traveling to an underdeveloped country. For hepatitis B, you want to get the vaccination before working in the healthcare setting. Immunoglobulins should be given post-exposure. For hepatitis A, you want to give the immunoglobulin within 14 days. And for hepatitis B, you want to get the immunoglobulin within 24 hours after exposure. Healthcare worker responsibilities in preventing spread of hepatitis. Use standard precautions, which may consist of just washing your hands, wearing gloves, trying to use needleless systems if you work in the healthcare field. Use aseptic technique. Handle and dispose of waste and used linen safely. Use personal protective equipment when risk of being exposed to body fluids. Use and dispose of sharps safely. Perform routine environmental cleaning. Report all cases of hepatitis to the local health department.
What is hepatic failure? It's when part of the liver becomes damaged and is not able to repair, resulting in liver not working anymore. Causes can be from acetaminophen overdose, long-term alcohol consumption, malnutrition, hepatitis, cirrhosis, and hemochromatosis, which is a genetic disorder where the body stores too much iron. Signs and symptoms can be nausea or loss of appetite, jaundice, easy bleeding, swollen abdomen, pain in right upper quadrant, fluid buildup in abdomen or extremities. How does hepatitis cause hepatic failure? When liver is exposed to causative agents like hepatitis, the liver becomes enlarged and congested with inflammatory cells, lymphocytes, and fluid. This leads to upper right quadrant discomfort and pain. As the hepatitis progresses, the liver normal lobular patterns become distorted from the inflammation, necrosis, and hepatocellular regeneration. This increases pressure within the portal circulation, which interferes with blood flow into hepatic lobules. Liver bile channels get obstructed by edema, causing jaundice. How does hepatitis cause hepatic failure? These are some statistics done by a study. This says 90% of patients recover from acute hepatitis B, while 10% develop chronic hepatitis B. 1 to 4 of severe acute hepatitis B cases can rapidly progress to acute liver failure. Approximately 20 to 80% of ALL cases result in death or transplantation. Which hepatitis cause hepatic failure? Hepatitis A is usually not threatening. Advanced age and conditions like chronic liver disease may cause widespread damage that require a liver transplant. Hepatitis B usually cleared from body and immunity is built, but people can become chronic carriers and be at risk for cirrhosis and liver cancer. Hepatitis C, most people do not clear the virus, and a chronic infection develops. It could damage over time, causing chronic inflammation, which leads to scarring to the cells. Hepatitis D occurs only with HPV and usually develops into chronic disease. Hepatitis, there's no evidence at this time of a chronic form of the disease, usually self-limiting and resolves on its own.
So NCLEX practice question number 1. A nurse is providing an in-service on viral hepatitis to a group of healthcare workers. They are teaching them about the types of viral hepatitis that can turn into chronic infections. Which types are known to cause acute infections only? Select all that apply. The answers are A and E. Only a hepatitis A and E cause acute infections, not chronic. Hepatitis B, C, and D can cause both acute and chronic infections.
NCLEX practice question number 2. A patient is diagnosed with hepatitis A. The patient asks how a person can become infected with this condition. You know the most common route of transmission is A, blood, B, percutaneous, C, fecal-oral, D, mucosal. Correct answer is C. Hepatitis A is most commonly transmitted via the fecal-oral route.
NCLEX practice question number 3. What is the most common transmission route of hepatitis C? A, blood transfusion, B, Sharp's injury, C, long-term dialysis, or D, IV drug use? The answer is D. IV drug use is the most common transmission route of hepatitis C.